Hello, my name is Tanya Kimber Jones, Workforce Solutions Manager at Chamberlain University. Thank you for joining our mastermind discussion about the value of telemedicine and what it brings to healthcare. Today, we'll be looking at how it brings value and what it means as far as the new normal. We are excited to have our brilliant panelists join us and share more about this dynamic topic. Telemedicine is playing a significant role in the delivery of quality of care. We will share an in-depth discussion about the importance of telemedicine and its inclusion in the healthcare setting. Today we have joining us Sherrod Woods, founder and CEO of 3NetWise Inc. Sherrod has worked in the medical device industry for over 20 years with Fortune 100 companies. Mr. Woods holds several patents in both medical device and health information technology. His most recent issued telemedicine patent is entitled Methods and Apparatus for Sharing Medical Information. Mr. Rod holds an undergraduate degree in both physics and electrical engineering from Xavier University in Louisiana and Howard University, respectively. He also holds a Master's of Electrical Engineering degree from Cornell University.
Thank you.
Dr. Danica Bowman is also joining us. She is the Senior Director of Healthcare and Global Partnerships within the higher education setting. Danica brings to us 20 years of service within the education industry. She holds an doctoral degree in leadership and change from Fielding University and an MBA from Keller University. Thank you for joining us today.
Thank you. I'm glad to be here.
Today, we also have Dr. Katie Kay, who is the Senior Director of Academic Operations at Chamberlain University. She is responsible for providing leadership to the university-wide operational quality initiative. Dr. Kay has over a decade of experience in nursing professions specializing in critical care, emergency medicine, healthcare system operation, and nursing administration. Thank you for joining us today, Dr. Katie Kay.
My pleasure.
So we're going to just dive right in and really get started because I think it's important for people to understand the differences between telehealth and telemedicine since our topic is about telemedicine. Sherrod, could you start us off with a little bit of information about the primary differences between telehealth and telemedicine?
Yeah, so today's market is telehealth and tomorrow's market is telemedicine. Telehealth primarily consists of remote non-clinical services, virtual visits with no patient vital sign data or information, and telecommunications technologies and services used to provide care and services at a distance. Whereas telemedicine is the practice of medicine using technology to deliver care at a distance. You're provided with real-time vital signs along with the video and audio chat with the physician. And it gives the physicians the ability to make accurate diagnoses with real-time patient data.
Wow, that is very intriguing. Katie, Dr. Katie Kay, would you like to elaborate from your perspective as a nurse and a nurse leader about those variables with telehealth medicine?
Sure. So I think what's so interesting about telemedicine is that you can really do it in different ways, both synchronous and asynchronous. So when we look at asynchronous patient encounters, it would be a patient that's reaching out to a provider, whether it's a nurse practitioner or physician, but not doing it in real time, but they are still providing that important, relevant clinical data. This may include pictures or symptoms to a provider that can review them on their schedule. Whereas synchronous patient encounters that we do with telemedicine are when the patient is actually one-on-one with a provider in a virtual clinical experience. So those are two different ways that we're offering telemedicine experiences currently. The other really important thing I think that we should highlight right now in light of the pandemic is the fact that we're really trying to work across state lines. So both physicians and nurse practitioners run into a lot of barriers with providing care across state lines. And hopefully we're learning some lessons about how we can really expand access to those that need it and provide primary care services and other relevant clinical services in a remote way with eliminating some of those barriers.
You know, you bring up something very important when you talk about crossing those state lines and breaking down barriers and improving collaboration and communication. Sharad, I kind of want to go back to you real quick because I think there's some differences in what your product has to offer versus what is currently on the market. Can you kind of walk us through what 3NetWise solution is all about and what that means to creating that synergy between healthcare providers, i.e. the nurse, the physician, the social worker? I think that would be important for our audience to kind of get a sense and understanding of.
Sure. So as I was saying earlier, with telehealth, really what you see what companies doing today is no more than a glorified video chat or FaceTime visit with no vital signs. So what we essentially do is, and what our patent speaks to is, we take a tablet like this Android tablet, and then we communicate with Bluetooth-enabled medical peripherals like this temperature monitor, a pulse oximeter, blood pressure, and also glucose, as well as weight. And so what we're able to do is to measure the patient's vital signs in real time while the physician is on the video call, and then to send that data directly to the patient's electronic medical record. So what we've done and what we're doing currently is we're working with Cook County Health and Hospital Systems to do a pilot with our system and enable patients with chronic illnesses to participate in this pilot and be monitored remotely from their homes.
Very nice. You know, Danica, as you're thinking about the implications for academics and being on the cusp of evolving and working with students to be effectively prepared to go into the marketplace, equipped to transform healthcare, can you share with us from an academic institutional lens, how can they go about addressing that gap between patient and practitioner during a pandemic such as what we're in right now?
Absolutely, Tanya. While telemedicine or telehealth has been around for decades, there has been an increased focus as a result of COVID. People who had not been utilizing it in the past are now being forced to be looking at it. Telemedicine is currently utilized by the majority of the healthcare institutions in the market, and it is quickly expanding. In the past, it was mainly used in rural environments and if there were some type of extenuating circumstances, but it is becoming much more mainstream. And the people who are utilizing telehealth and telemedicine during the pandemic, they're finding that they like it and that it's saving them time and it's saving them energy. And it will be very interesting to see how many of them continue to use it post-pandemic. Just as an example, I spoke to a friend who used it for the first time. And to Mr. Wood's point about just the exposure of it, she was incredibly impressed by the question, the evaluation, and the use of video to diagnose the concerns. I recognize that it's coming a lot further than just utilizing the video, but just by being able to show swollen ankles as a result of the medication, you know, she is now a major fan of this way. The academic institutions are training our students to be excellent at this skill set and exceed the expectations of our students. The bottom line is that our nurses need to be trained to not just use telemedicine, but also to do it in a professional, safe, and an evidence-based manner.
Thank you. You know, I really like how you talked about how the academic institutions are now incorporating that into the engagement and into the academic experience. I would like to take that a little bit further with you and Katie, if you don't mind, and either one of you all can chime in at first. But what role would you say the undergraduate education plays in telemedicine?
Well, there's several different ways that our undergraduate students can be involved in telemedicine. I think the first and most important thing that we can do as an educational institution is work with our clinical partners to find out what their needs are. So, we have ideas about, what services that they can be involved in, including managing health lines and those types of services. But what's really important is that we're meeting the needs of our clinical partners. So that's always where I start.
And of course, I agree with Dr. K. And just as telemedicine becomes more ubiquitous in our nation's healthcare delivery system, it's imperative that our healthcare providers are trained to leverage this technology and to do it in an effective manner. So the goal is to build this telemedicine competencies into our existing components of our curriculum. It's no surprise that the curriculum is already extremely full. And by building in these directly into the curriculum, it allows you to make these linkages between the different topics. Within many institutions, telehealth exposure exists within the curriculum only implicitly, which prevents the quantitative analysis. But at other institutions, the telemedicine competencies may be formally included in the curriculum, but not implemented in practice. What I'm trying to say is that we need to embed telemedicine in the curriculum, study the efficacy, and ultimately create an experience for the patients that is extraordinary. When I think about it, I would describe telemedicine as budding growth and promising development, but we need to move beyond just the simple exposure to it and the technology and seek to augment with exposure to a basic understanding of like complex governmental, socioeconomics, and cultural principles that would be involved. The good news is the pace of development is incredibly brisk, and I'm excited about the new direction. That COVID is definitely not a good thing, but it is causing us to accelerate very quickly.
Yes,
that's a great point.
Go ahead, Katie.
No, that's a great point. I think that this has really been a disruption in the way that we're delivering healthcare in a positive way. And when we look at areas of the country that are more so affected than maybe perhaps others, and they're running out of space at the hospital, and patients aren't going to see their primary care provider because they either have offices that are closed or they are afraid, to be honest, and don't want to be exposed to potentially another patient that has COVID. So really, just kind of discussing some of those challenges that those patients are facing, but also then giving them the options of what is available to them, and that we can have a really meaningful telemedicine encounter where we are looking at your clinical data in real time, I think is important. So there's a lot of education that needs to happen, not only in educational institutions with our students who may have previously only been learning really definitions. What does it mean? But they weren't putting it into practice because that wasn't really our norm. So now we're transitioning. So our healthcare providers, our nurse practitioners are learning, but so are our patients. So we all have to be working together. So that's why I look at it as really just a disruption in the way that we've been delivering healthcare.
A disruptor that actually brings about change and transformation. So I think that's really important to note, and I really appreciate you two highlighting that. Sherrod, listening to what has kind of been outlined here, and as an inventor and a owner of a product that is speaking to what Katie and Danica have kind of highlighted, how can you as a organizational owner potentially look at partnering with academic institutions to help bring that to the forefront as far as educating and empowering students to be prepared effectively?
Sure. So our system is a web-based system, which means that you can log on from anywhere in the world. And so that type of medical collaboration could really help students to discuss patient's condition with the patient on, as well as the physician or nurses that are on the call as well. So with our system, up to 5 persons can participate at one time, along with the patient's real-time vital signs.
Awesome. You know what, Sharad, could you give us a little bit of background on how you even got involved with telemedicine? And the reason why I asked that is because it's different again, right? You know, you've kind of highlighted, everybody in this conversation has kind of talked about the variances rather between telemedicine and telehealth. And I feel like you're on the pulse beat of something new and innovative. Can you kind of give us a sense of how did you create this new product?
Sure. So back in 2006, 2007, my company was basically doing Cisco certified networking. And I got a call from one of my old professors from Howard University, Dr. Carter, who's an MD, PhD. And he had just recently won a National Institutes of Health contract to do telemedicine. And at that time, they were using these large kiosks where the patient would come in, put their arm in a blood pressure cuff, and they were doing it over phone lines. And I told him, I said, Doc, there's a much better way to do this. I think that we can leverage better technology to do this. And he said, well, if you think you can, you know, go ahead and do it. And so I did that, and I filed a patent back in March of 2008, myself along with a few software engineers and a couple of physicians. And we filed the patent in March of 2008, and it took 10 years, but we finally, the patent was issued June 26th of 2018. And so what we've been able to do is, with this pandemic, is to move quite quickly with hospitals, especially, to be able to remotely monitor their patients. So as I was saying earlier, in 2 weeks, we started a pilot with Cook County Health and Hospital Systems in Chicago. And they're the 3rd largest public health system in the country. So it's going to be really interesting to see how our system is going to be pressure tested, you know, under these conditions. One of the things that we had in mind when we initially designed the system, I think someone mentioned earlier about, you know, socioeconomics. And so we knew that there would be patients who couldn't afford to have internet service, unfortunately, in underserved communities. So one of the things that we're doing is with the tablets that we have, they have cellular chips inside. So the patient doesn't need to have internet access, and it only costs about $5 a month. And so we're providing that service to make sure that patients have access to quality health care.
That is amazing when you really think about that. And I loved how you touched on the socioeconomic implications, because we all know in disadvantaged areas, it's very challenging for people to get to the doctor, or they may very well be treating the emergency room as their doctor. So instead of routinely going to see a physician or a nurse practitioner on a regular basis, they're going into the emergency room. So this is a great way to potentially reduce readmissions rates, as well as have that ongoing engagement between the physician, the nurse practitioner, the nurse, or anyone that may be on that care team, which is really cool. Katie, you know, speaking from the lens of the nurse, how do you feel about that type of technology and the implications that it may have on the socioeconomics or the social implications of health?
Well, you brought up some excellent points about the use of the emergency room for primary care services, and some of the more challenging situations that we encounter in the healthcare system is that we don't have that really strong connection with our patients in a primary care setting anymore, like we did in years past. I think connecting with the patient in this way and having an option for them to really see their data in real time, see how they're doing, be able to log in, chat with their nurse, chat with their provider, and really keep that engagement while they're out of the hospital is really critical in maintaining overall health. I always talk about hospitals treat sick people. They don't treat healthy people. And the goal of healthcare is to keep our patients out of the hospital, living as optimal as they can. Having that connection consistently is really key. And bridging that gap with telemedicine and telehealth, I think, is going to be so important.
Thank you so much for that, Katie. Danica, I wanted to bring you back in the conversation because I wanted to go back a little bit about those barriers that we can face. What are some of the barriers that we can overcome with this widespread adoption of telemedicine and training? I know we kind of talked about it high level earlier, but I want to drill down a little bit more with you. So if you can elaborate with that, that would be great.
Will do. Telemedicine is used widely in the majority of countries as a tool to increase access to healthcare through the elimination of proximity from the equation of care. So let's talk a little bit about what we heard earlier. I agree completely. Technology barriers and lack of computer literacy are major barriers to widespread adoption. That's why it makes me smile to hear some of the solutions that are on the table. This goes back to the importance of some of the prior points of training, both within academic institutions and within the healthcare system. Some additional barriers that are often cited include privacy and confidentiality concerns, security of data, and of course, the famous resistance to change. There are many people that are resistant to trying telehealth or telemedicine simply because it's different than what they've done in the past. But again, this pandemic is forcing a shift. So it's going to be very interesting to study what percentage of people actually prefer this and actually are requesting it down the road. But again, it comes back to the experience for the patient. If they're satisfied and their needs are met, then the use of telemedicine will continue to grow.
Outstanding. Katie, did you want to add anything to that?
I think she highlighted it really perfectly. Access to technology is really one thing that's just as challenging as access to healthcare providers. So hearing the cellular data piece and some creative strategies around that, I think is really critical. So I'm just really excited to hear that in the direction of where this can go.
Awesome. Well, that is all of the questions that I have for each and every one of you all today. I appreciate you all taking time out to discuss with us a little bit more about telemedicine and telehealth and the implications it has on healthcare. Please stay tuned to our next mastermind session where we discuss a little bit more about comfort zones. Thank you and have a great day.